I'm just going to go over a few tips and tricks to help you get started as you navigate Epic. I'm in Flowsheets, which is where you do most of your documentation. One thing you should know is that insert column allows you to back time it. So if you bladder scanned at 9 o'clock or you did something at 9 o'clock, you can back time it to that. Add column puts a column in for right now. Add row can help you find things. I'm going to need to be in a PCS assessment to be able to find things, but I can go to add row, and if I'm looking for pulses, I could find, okay, so there's where it is, and I can just add it in from here. So if you're looking like, I know I've charted that before, where is it? Add row helps you tremendously. All of the PCSs, so there's a PCS for every type of nursing. So the main med-surg one is called the adult PCS. There's a peds one, there are a ton of them. Any of the body systems have what are called WDL statements. So WDL statements allow you to chart within designated limits. It is really important that you see this row information. And if you noticed here a second ago, that row information was missing. And what generally happens is someone or you have clicked this arrow and it's made it go away. So all I did was click the arrow at the bottom and that makes it come back up. So here's my definition. If all this is true, then this is WDL and you don't need to find all the normals. If any of this is missing, so say their nose is packed or something like that, or they have ulcers in their lips, you're going to pick accept whatever's wrong, and then that's going to open up more. I was able to move that forward by right-clicking as I selected, so if you've got a bunch of different objects, let's see, for nose symptoms, left nostril and right nostril, see they're swollen, unable to breathe through. Once I've selected all these, I can right-click, and that's going to move me forward. So it's left to click, right to stick, and move forward. That's just one way to speed things up. Let's say they've got bloody drainage. Again, I'm right-clicking once I'm ready to move on. So I'd go through all of these body systems and figure out whether they are or not meeting the WDL statements. In a lot of places, you can use T for today and N for now, so not for these sort of flow sheets, but some of the places where it's asking for a date. Let me find it here in the poop. You can navigate a little bit by clicking and having this navigation open. That can speed you up a little bit. So I can type in T for today. You can also do T-1 for yesterday. And then if there's something that wants a time in works. It doesn't work in notes, but it does work in flow sheets where you have some of those. For more flow sheets, you're going to search in this thing. One flow sheet everybody forgets about is the pre-op. We are supposed to be doing this for any patient going to surgery. Sometimes it doesn't show up on the preference list and you have to go to the facility preference list. So if you're not finding what you're needing and you know it is, the facility preference list generally has what you need. So just a reminder to do your pre-op pre-sed checklist. So definitely this section here. Make sure that gets done for your patients going to surgery. Other ones, I pull a lot of restraints, things like that. Flow sheets that you don't use a lot, you can search for. If they're flow sheets that you do use a lot, you can wrench them in. But what shows up isn't always just the things you've wrenched. Intake and output can be tricky. So if I try to put an amount in here, so say my patient drank 210, it's not going to let me do that. And the reason is this is just an overarching oral intake. I'm going to have to click on this hamburger menu to open that back up and go to add PO. I can change what that is, so especially if you're working a specialty area, this is breast milk or other things, then you can do it. Any of these that have that, you can change. So if I wanted to separate out that this was water or ice chips or something like that, I can edit some of those if I needed to. The same thing happens with urine. I can't put a number here. If you had a patient that tried to avoided a little bit, and then you put a Foley, you can actually select both and document both at the same time. So say they peed 50, but you still bladder scanned them for 700, and then you put in a Foley, and you got 725. That's how you would document this. This is where your bladder scanner is. It moves back and forth sometimes between the patient care summary and intake and output. It's currently an intake and output, so this is where you would document bladder scan. Hamburger menus, I showed you a little bit of a hamburger menu here with the PO. You can see them more in these patient care summaries. So anywhere here, you can actually see more options. So if you're looking for a different pain scale, or you're looking for more information besides what you're getting in the accept, you can pull that from here, and you would just select it. Say I want to talk about vision change or something, I can accept that, and then they'll pull in. This here is brain, so I'm signed into my patients, and I've pulled them into my list of things, and this is going to show me tasks. So labs, you can tell that we got our labs. You can add tasks so you remember to do things, and then it will also show you medications. So brain's super important. We're using the brain more and more to make sure that we're capturing the documentation that's required. Pain reassessments, things like that, turn. So making sure you're using brain will help you tremendously as you get used to being a nurse. I'm going to move into the MAR, show you a couple tips here. I'm very overdue on all my meds. If you click into the white area here, you'll open up more information about your medication. So you're going to see a couple things. Micromedics has a more complicated view of your medicines. The best part of Micromedics, and probably what we use the most, is its IV compatibility. So if you're trying to figure out if your IV solution is compatible, use the IV compatibility function here. Otherwise, in live, you have MedPass in a Minute, which has a much more simplified, I know I cover it in another video, but MedPass per minute is here as well. You can adjust times. The rule is you just can't adjust insulin times, but if a patient takes something at night and it's scheduled for the morning, you can adjust that time. If you have any questions about whether you should or not, the other one you absolutely can't do is any time critical meds, but do talk to your pharmacy or your provider if you have any questions about whether something's appropriate to retime. A couple of things here. This is the button you would click if you need to request medication, so that's that one. This exclamation point says that pharmacy hasn't verified yet, so it's not going to come up for you. You're not going to be able to pull it from the Omnicell unless you're overriding it as an emergency med, which not all meds are, if you have this exclamation point. If you have meds that are due, using the med due column makes a huge difference. So this is just showing me the meds due. You can also look at your meds overdue. So if you do have both, make sure you've gone to both of them. It's not going to pull your overdue meds into your meds due, but this really helps you get the whole MedPass done. If you're trying to figure out what antibiotics, the meds due has helped me tremendously. Your required documentation for a shift is dependent on a lot of things. We're going to give you a tip sheet about kind of where, especially for med-surg, what the required documentation is. It does include a head-to-toe assessment. The rules change a little bit for observation patients. Those are more of a focused assessment outside the admission. And then education every shift, so documenting education and that learning needs assessment at the beginning. So on admission, you document a learning needs assessment, and then we document education every shift, and then your care plan every shift. So those are everybody's responsibility. We also ask you to write an end of shift note to kind of summarize your patient's day. We use coded notes, which I can't pull over into Playground, but usually it's .srmh end of shift, and that will bring up a note. This is how dot phrases work. You just type in dot whatever it is. So there's a provider notification, there's the 4Eyes assessment that allows you to co-sign or document who did your 4Eyes with you and bring in that image. In order to be able to pull in that image, I need to have the type as progress note, and then it's this button. So once I had that dot phrase of who I did it with, I'm going to click on the image and it's going to pull that image in. The last kind of note I want to cover is an SBAR note. So if you're typing in SBAR, so it's SBAR is a type, and SBAR in this little box, not a dot phrase. So it's SBAR, SBAR. There's a couple different ones. There's a sepsis SBAR and a regular. And that's just going to bring in this situation, brings in some coded information about their past medical history or active patient list. And then these work by clicking on the pink boxes. Okay, so I do want their past medical history. And then here I'm just going to type, and that's going to cover up those 3 dots or asterisks. So if there were changes in mental status, cardiac status, and respiratory, I'm going to pick all of those. Again, left to click, I'm going to right click while I'm in this box, that's going to pull them in. And then here I'm going to type in, so I'm more confused. And then it's going to pull in their last vital signs. And if anybody had charted any breath sounds or perfusion, those would come in. And then the last, I'm going to go ahead and cancel this note. Last note I want to show you is a critical result note. And it is, so it's critical and critical. So critical result treated per protocol. That would be if you had a critical result like for a heparin drip that you treated per the protocol. So let's say no, you'd gotten a call that like a potassium was really high. This is who you talked to, the date. This is not a place I can put T in, unfortunately. So the rule is that you have to document a critical result. You have to call it to the provider within 30 minutes, and you have to document a note. And then they have to read back and confirm. Okay? There are times you get best practice advisories. They pop up into your charting. They kind of live a couple different places, but they'll pop up and you'll have to deal with them. One of them is sepsis. So on admission, and then if the BPA fires, we are doing a sepsis assessment. So again, I'm back in flow sheets. I can pick sepsis, and it says, what was your reason for assessment? It could be you were just wanting to check, or you had the sepsis alert fired. After the assessment, do you feel like there is new or worsening sepsis? So it's going to give you kind of in the sidebar the sepsis assessment reference tool, when to call MERT. Here tells you what to do. So if you're, do you suspect, do you not? If you do say unsure, need more information, after you file it, it's going to open up this BPA and it's going to open the order set. And that allows you to order any labs that haven't been resulted in the last 6 hours. So if we had some recent labs, some of these may be unchecked. What it doesn't include is blood cultures, because that's not going to help you make a decision about it. So it's just going to order those. You're just going to sign them off as an implement protocol. and then you get those results. You need to get vitals again in an hour, and they become Q1 times 4 until you make a decision, just to make sure your patient doesn't deteriorate more. The last flow sheet I want to highlight is the HAI. I got there just by typing in HAI. So this is where we document the treatments for all of our different HAIs. They're also sprinkled through other assessments, but if you're trying to figure out where it is or what is happening, here it is. So this is the skin treatment and nasal antiseptic documentation for MRSA. This is the CAUTI 8-step catheter care. Here's the bundle for central lines, for Foley's, and for ventilators. So if you're trying to find all of that, it's here. There used to be a CAUTI and a C. diff one as well. The CAUTI one went away. There is still the C. diff stop huddle. So if you have a patient having diarrhea, this is where you're going to go to document your C. diff stop huddle. So again, I just typed in CDI or stop huddle, either one, and this is where you're going to figure out what the heck day it is. So once you put in the date that your patient arrived, using this, so they came in on the 24th at 11:52 p.m., that's still the 24th, then it knows that today's day 3. So it says day 1 to 3 send sample.